Okay, so you want to understand type 2 diabetes better. And you found this interesting YouTube video,
Mm-hmm.
and it's called Understanding Type 2 Diabetes.
Yep.
It's from the Animated Diabetes Patient channel.
Right.
So let's dive in and see what we can extract from this thing.
That sounds good.
So our goal today is to basically just understand type 2 diabetes, like what it is,
Yeah,
what the impact is, and what it all means for you, the listener.
absolutely. I think that's a great goal. And you know what I really like about this video is that it uses animation
Okay.
to explain these kind of complex medical concepts, and it just makes it a little bit more engaging
Right.
and easier to grasp.
Yeah, for sure. So let's get started with the basics. What exactly is type 2 diabetes?
Well, it's basically a metabolic disorder
Okay.
that messes with how your body uses glucose for fuel.
Hmm.
Glucose is just sugar.
Right.
And instead of going into your cells to give you energy,
Right.
it builds up in your bloodstream.
So like almost like a delivery truck full of packages.
Thanks.
Stuck in traffic and never reaching its destination.
Perfect analogy.
Okay.
And insulin is really the key player here.
Okay.
It's a hormone made by your pancreas,
Hmm.
and it's basically like a key unlocking your cells to let that glucose in.
So insulin is like the key to opening the door for the glucose delivery.
Exactly.
Okay, got it.
Got it.
But what happens in type 2 diabetes?
So in type 2 diabetes, your cells become what we call insulin resistant.
Okay.
It's like they're ignoring the key, right?
Mhm.
And then to make matters worse, your pancreas has to work overtime,
Oh, wow.
producing more and more insulin to try and overcome that resistance.
Okay, so I get how insulin resistance works, but honestly, like, I still struggle to really grasp how lifestyle choices, like, actually reverse it.
Yeah.
Can you kind of break that down?
Yeah, so think of it this way.
Okay.
When you make healthy choices, like exercising regularly, eating a balanced diet,
Right.
you're basically helping your cells become more sensitive to insulin again.
Hmm.
So exercise helps your muscles use glucose more effectively. Okay.
And a healthy diet prevents those blood sugar spikes that contribute to insulin resistance in the first place.
So it's like we're giving our bodies the tools they need
Yes.
to use the insulin effectively again.
Exactly.
Okay, I like that. Now, how do we even know if something's up? Like, how do we know if we might have type 2 diabetes?
Well, type 2 diabetes can be pretty sneaky.
Uh-huh,
It develops gradually,
right?
and some common symptoms include frequent urination,
Go.
excessive thirst, unexplained weight loss, increased hunger fatigue, blurry vision, and slow healing sores.
Wow, that's a lot of different things to
Div-
scout for.
Yeah. And what's really alarming is that 1 in 4 people with type 2 diabetes don't even know they have it.
Oh, wow, that's a huge number.
It is a huge number.
That's like a serious wake-up call.
It is.
So being aware of these symptoms and just getting regular checkups
Yes.
is so crucial, especially if we have any risk factors.
Absolutely. And speaking of risk factors, there are several to consider.
Being overweight or obese, physical inactivity, family history of diabetes, age over 45.
Okay.
And certain ethnicities like African Americans, Hispanic Americans, American Indians, and Asian Americans are all at increased risk.
It's interesting how certain ethnicities are more prone to type 2 diabetes.
Right.
I wonder why that is.
Yeah, it's a good question, and there are a lot of factors that play into that.
Okay.
Genetics, cultural influences on diet and lifestyle,
Mm-hmm.
and even socioeconomic factors affecting access to healthcare and healthy food.
Okay.
It's complicated.
Yeah, it's a lot more than just individual choices, it sounds like.
Absolutely. There are a lot of broader societal influences there.
Yeah. And it's important to remember that some medications,
Yeah.
like corticosteroids
Hmm.
or certain mental health drugs, can also increase your risk of developing type 2 diabetes.
Yeah, for sure. Always
Yeah.
a good idea to talk to your doctor
Right.
about any potential side effects.
Yeah, so we talked about the symptoms.
Yeah.
And we talked about the risk factors.
Mm,
But what if it goes unmanaged?
right.
What happens long term if you have type 2 diabetes that isn't being taken care of?
Well, high blood sugar can damage blood vessels,
Okay.
and those are like tiny pipes
Right.
that carry nutrients throughout your body.
Okay.
And damage to the smaller vessels can lead to vision problems,
Uh-oh.
even blindness,
Wow.
nerve damage, and kidney disease.
Oh, my goodness.
And then damage to the larger vessels can lead to heart disease, stroke, and poor circulation.
So it's not just about a number on a blood test.
No,
It's about your whole body.
it really is. It's about protecting your overall health.
Yeah, and that's where I guess prevention and early detection come in.
Exactly.
So what are some things that we can do to lower our risk or
Yeah.
manage type 2 diabetes?
So maintaining a healthy weight through diet and exercise is crucial.
Okay.
Even losing a small amount of weight
Right.
can make a big difference.
Okay.
And speaking of diet, Choosing foods that are lower on the glycemic index,
Hmm.
rich in fiber and low in saturated fats, can really help regulate blood sugar levels. Okay.
You might also have heard of HbA1c.
Hmm.
That's basically an average blood sugar reading over the past few months.
Ooh.
So it gives your doctor a better picture
Oh,
of your overall diabetes management.
okay. So I have to admit, I have a little bit of a sweet tooth.
Sure.
So hearing about all this dietary stuff is always kind of daunting to me.
Yeah, I understand.
What's a realistic first step that I could take?
Well, I think the key is to start small.
Okay.
Don't try to overhaul your entire diet overnight,
Right.
but instead focus on making gradual, sustainable changes.
Okay.
So maybe swap sugary drinks for water or unsweetened tea.
Okay.
Choose whole grains over refined grains.
Mm-hmm.
Incorporate more fruits and vegetables into your meals.
Right.
And don't forget about exercise.
Yeah.
Aim for at least 30 minutes of moderate intensity activity
Okay.
most days of the week.
So small changes, but consistent.
Exactly.
Right.
Consistency is key.
Okay. Got it.
And remember, knowledge is power.
The more you understand about type 2 diabetes, the better equipped you are
Yeah,
to take charge of your health.
right. So to kind of sum up everything that we talked about today,
Yeah.
type 2 diabetes is a serious condition,
Absolutely.
but understanding it empowers us to take action.
Definitely.
We've learned about the causes, the symptoms,
Mm-hmm.
the risk factors, the complications,
Right.
and most importantly, the steps that we can take to prevent it or to manage it.
Absolutely. You've hit the nail on the head.
Cool.
Knowing your risk factors and making informed lifestyle choices can really make a huge difference.
So if you're experiencing any of those symptoms that we talked about,
Yes.
or if you have concerns about your risk,
Mhm.
please reach out to a healthcare professional.
Great advice.
They can give you personalized guidance and
Yeah,
support.
absolutely.
This deep dive is just the beginning
It is.
of your journey to understanding type 2 diabetes.
Right.
So keep asking questions, stay curious, and take charge of your health.
Couldn't have said it better myself.